Good afternoon, everyone. Thank you for joining us today. I am pleased to be here with Dr. Peter Topham and to announce just prior to the World Kidney Day, which is a day where globally communities are working to raise awareness about the importance of kidney health, preventing kidney disease, and treatment. And given that this year's theme for 2024 World Kidney Day is Kidney Health for All, advancing equitable access to care and optimal medication practice. And it is entirely fitting for Dr. Topham to join me today as we share the key findings and the recommendations of the first phase of work on the Universal Health Coverage Chronic Kidney Disease Integrated Care Pathways Initiative. Universal health coverage is about ensuring equitable access to those in need, quality health care without creating a financial burden for the person that's requiring the care. The Chronic Kidney Disease Integrated Care Pathway is a multidisciplinary approach that details the essential care steps for people experiencing chronic kidney disease. The pathway specifies the care provided for kidney disease patients from beginning to end and defines what happens, when, and who is responsible for each stage of care throughout that journey. And this includes the prevention, presentation, diagnostics, diagnosis, treatment, and discharge or end of life for those at risk of or experiencing chronic kidney disease. The disturbing reality for our community is that 50% of our residents have at least one chronic condition such as diabetes, heart, or kidney disease, and the data reflects that this number unfortunately continues to grow. Chronic kidney disease not only has a disproportionate impact on the island's health cost burden, but not surprisingly, its prevalence is reflective of other chronic diseases in our community, such as diabetes, obesity, and hypertension. The 2023 Joint Strategic Needs Assessment states, and I quote, "Bermuda appears to have a disproportionately high number of claims and costs for chronic kidney disease, and that the prevention of chronic kidney disease should be a priority." Simply put, chronic kidney disease ranks amongst the highest medical expenses for Bermuda. Given the high prevalence and the high treatment cost of this disease on island, the existing model of chronic kidney disease care in Bermuda is unsustainable. The Chronic Kidney Disease Integrated Care Pathway Initiative is one of three that have been undertaken by the Ministry of Health in 2023. And you may recall the key findings and recommendations of the Acute Adult Mental Health Integrated Care Pathway that we shared publicly last month. Next month, we also expect to share the results of the first 1,000 days integrated care pathway, which covers conception to children up to and including the year of 2 years of age. And the work of these pathways is in addition to the pathways that have already been completed or in progress by the Bermuda Hospitals Board. The Chronic Kidney Disease Integrated Care Pathway work was driven by a multidisciplinary working group led by Dr. Tomlin, who is the consultant nephrologist to the Bermuda Hospitals Board, and it was supported by KPMG. The working group also included Dr. Lynette Thomas, who's a nephrologist at the Bermuda Renal Associates, and Irina Ashton, who is a dialysis nurse at Kidney Care Bermuda. Consistent with all the other pathway initiatives, this pathway initiative provided the opportunity to gain a deeper understanding of the current provisions of chronic kidney disease-related health services in Bermuda, understand the patient's experiences of these services, and identify both challenges and opportunities to be addressed or capitalized on to ensure an effective, efficient, and patient-centered care that is accessible and reflective of best practice. Over a 20-week period, an extensive literature review was completed, along with broad stakeholder engagement. Interviews were conducted with patients with lived experiences, clinicians, health insurers, and nonprofit care providers. 2 workshops were also facilitated, including participants representing patients, nephrologists, labs, family and social services, insurance specialists, clinicians, nursing staff, and primary care providers. 35 interviews were conducted with chronic kidney disease patients, family members, clinicians, mental health experts, law enforcement agencies, judicial representatives, and community members. Also, 2 stakeholder workshops were facilitated, including one with patients and families with lived experiences. Participants also included clinical specialists, nursing staff, primary care physicians, allied health professionals, diagnostic professionals, family and social services, health visitors, and the nonprofit sector. This work combined led to 5 main challenges and 17 opportunities for improvement being identified for the current state of chronic kidney disease integrated care pathway. And at this time, I'd like to invite Dr. Topham, to share with you the key findings and recommendations of the working group, after which I will discuss the next phase of work for this integrated care pathway. Thank you.
Thank you, Minister Wilson, and good afternoon. It is my pleasure to share with you the key findings and recommendations that are the result of the collective work of the Chronic Kidney Disease Integrated Care Pathway Working Group and stakeholder feedback. Chronic kidney disease impacts a growing number of Bermuda residents and, as Minister Wilson noted, is placing a disproportionate and unsustainable burden on the island's overall health system. Following the extensive literature review and stakeholder engagement work, it is clear that a comprehensive approach to early identification and prevention of chronic kidney disease is required. For these are the key drivers to both enhancing patients' quality of life and reducing costs across Bermuda's system. In addition to the high prevalence and high costs of chronic kidney disease, our study also identified significant financial, cultural, and informational barriers to accessing care related to chronic kidney disease. For universal health coverage to be fully realised, these barriers to accessing care must be addressed as a matter of priority. More specifically, chronic kidney disease requires ongoing medical care, including regular consultations, diagnostic testing, and medications, all of which can be costly, especially for our un- or underinsured patients. The inability to cover the cost of care may deter people from seeking out the care they require. There are also some members of our community who may have personal, cultural, or spiritual beliefs that discourage seeking out appropriate care, or who rely on other approaches to healing until their health condition worsens. For most people, chronic kidney disease is not associated with any specific symptoms, and this can lead to both delayed diagnosis and to initiation of treatment at a more advanced stage of disease when it is less likely to be effective. The lack of easily accessible health literature can prevent residents from understanding the symptoms, risks, available healthcare resources, treatment options, and the self-management strategies for the prevention and effective management of chronic kidney disease. 5 main challenges for the provision of care for chronic kidney disease are highlighted in the final report. Firstly, the lack of prevention strategies and a structured screening programme for chronic kidney disease in Bermuda results in delayed diagnosis and missed opportunities for prevention. Secondly, health providers have identified public knowledge and awareness of chronic kidney disease as low, which can hinder prevention, diagnosis, and effective management of the disease. Thirdly, the lack of adequate coordination and communication between health providers, including primary care physicians, specialists, and support services, negatively impacts the ability to provide seamless care delivery and the achievement of optimal health outcomes for patients with chronic kidney disease in Bermuda. Fourthly, the high cost and ongoing need for care when experiencing chronic kidney disease, combined with cultural barriers such as reluctance to seek out health services and inadequate education about chronic kidney disease prevention and treatment, create barriers for residents in accessing necessary health services related to this disease. And fifthly, Bermuda currently does not have a comprehensive policy around organ donation. The low level of organ donations and absence of comprehensive transplant facilities on island creates obstacles to providing timely and accessible organ transplant services. As a result, treatment options are limited for individuals who are in the end stages of chronic kidney disease. Importantly, our work has identified 17 opportunities for improving the delivery of care and overall health outcomes for residents with chronic kidney disease. Not surprisingly, the opportunities for improvement focus on enhancing prevention and early detection, improving education and awareness of chronic kidney disease, improving the coordination of care and communication between health service providers for stronger patient support, enhancing access to and the affordability of care, and enabling more organ donations and transplants. Of the 17 recommendations, I would like to highlight the following 4. Firstly, to address the issue of delayed diagnosis and treatment, it is recommended that targeted prevention and screening programs are developed to identify people experiencing chronic kidney disease at an earlier stage where the course of the disease can be altered. Secondly, to address the problem of financial, cultural and informational barriers to both accessing care and receiving the necessary treatment to prevent the progression of the disease to end-stage kidney disease, it is recommended that a thorough assessment be completed to identify the greatest barriers to care and a multidisciplinary task force to be created to develop effective solutions for these barriers. Thirdly, given the limited availability of organs for transplantation in Bermuda, promoting organ donation through targeted campaigns could significantly increase the number of kidneys available, thus significantly reducing the wait time and limited access to life-saving transplants. And fourthly, promoting achievable lifestyle modifications is key in the moderation of the progression of chronic kidney disease. It is essential for primary care providers to provide achievable lifestyle modifications in Bermuda that are tailored to the local context and individual needs, and also take other conditions such as diabetes, hypertension, and periodontal disease into account. Within this, it would be remiss of me not to mention the healthy lifestyle choices that we can all adopt as part of the prevention strategy for chronic kidney disease. And these include adopting healthy eating habits and choosing foods such as fruits and vegetables and whole grains while moderating your intake of overly processed foods. Drinking plenty of water, which is essential for kidney function. Incorporating regular exercise into your weekly routine. Being active for 30 minutes a day can go a long way in improving or maintaining your overall health. And getting the sleep your body and mind needs to restore itself and to function optimally. Before the end, I would like to extend my personal thanks to all those involved in this work, particularly those with lived experience of chronic kidney disease and their families. Their collective insight, experience and expertise that we had access to during this period enabled us to develop both the service map and the future patient care pathway that now becomes the roadmap for improving chronic kidney disease care in Bermuda, while at the same time addressing the issues of cost and, most importantly, optimizing patient health outcomes. Thank you.
Thank you, Dr. Topham. Excuse me. I too would like to join in the chorus and thanking all the members of the working group and all the stakeholders who are willing to share their time, expertise, and experiences. Your efforts in producing this first phase of work not only provides a high-level roadmap for the next phase, implementing solutions to improve care for chronic kidney disease, but it also sets the tone for what is possible when we work collectively. Behind a common vision, a stronger health system that is easy to navigate, provides better health outcomes, and is accessible and affordable to all. While the barriers to care for chronic kidney disease that Dr. Topham just spoke about are not insignificant, many are addressable. It is important to note, as you've heard me say before, that the government cannot implement all of the recommendations, nor can they be implemented by stakeholders working in silos. It will take a continued collective participation and commitment of all stakeholders, including the government, health service providers, insurers, people with lived experiences, and residents alike, to continue to lean into this work. The heavy lifting begins now. Phase 2 will include actioning the prioritized recommendations. The Phase 2 working group is in the process of being formed so that they can commence work on implementing the key recommendations that are included in the final report. To download the Chronic Kidney Disease Integrated Care Pathway Report, go to www.healthstrategy.bm/latest updates. Implementing universal health coverage and strengthening our overall health system requires a collective effort. The government, again, cannot do this work in isolation, nor should it. In closing, let me reiterate the Ministry of Health's commitment to driving the implementation of universal health coverage and providing access to affordable, quality health care to all residents of Bermuda in partnership with and including all health stakeholders. And the success begins by having a willingness to acknowledge existing challenges and then being proactive, thoughtful, and holistic in the approach to implementing the required solutions. This phase one work provides the foundation for doing just that, creating a more effective pathway of preventing chronic kidney disease, improving the health outcomes and quality of life for those living with the disease, and highlighting concerns around affordability and access to treatment as we continue our work in strengthening Bermuda's health system overall. Thank you.
We'll now invite questions from the media.
Thank you. Good afternoon, Minister.
Good afternoon.
Given that chronic kidney disease is putting a financial burden on the island's healthcare system, have you been able to pinpoint an exact annual cost?
I'll yield to Dr. Tomlin in a moment, but I can say that based on our last STEP survey and last data that was produced, we spend approximately $77 million per year just on dialysis. So you can appreciate that's quite a substantive amount of our overall healthcare costs. So it is a staggering amount. Did you have anything?
I guess what I'd say is that proportionally the number of people on dialysis here is maybe twice what it is in the United States. So there's a lot more people on dialysis here, and the cost per year of dialysis here is more expensive than it is in the United States as well. So both of those things make it a very, very expensive issue.
Understood. And is the need for dialysis increasing?
I'm not sure I can answer that. I don't think it is at the moment. I think it's probably peaked from my experience since I've been here, but there are still people coming through needing dialysis. I think it's also right to say that the majority of people coming through needing dialysis now have the kind of disease where there is potential to influence the course of disease if they were detected earlier.
Okay.
Yeah.
And does the report provide an audit at all of the available dialysis machines on island, in the hospital, and in community providers?
Not specifically. What I would say is that currently there is no limit to the availability of dialysis. So there's no necessary constraint on dialysis at the moment. So that's not the issue. I think it's just the issue of, there's a financial issue about it. But the other thing to remember is that being on dialysis is terrible for patients. It's a huge undertaking for them to go through. It's a big lifestyle change. And whilst it's a life-saving treatment, it doesn't get you back to normal, it doesn't put you back to a normal lifespan, for instance, and it is associated with complications. So for a variety of reasons, it's a really important thing to try and prevent.
Of course.
Yeah.
And so one of the challenges you highlighted was Bermuda's limited organ availability. Have you been able to identify any reasons for this?
Right, okay, so one of the big issues is that transplantation isn't done on island, so people have to travel off island to get transplanted. Probably about 60% of transplants are done from deceased donors, and it's quite difficult, being based on island here, to be integrated into a deceased donor program when you have to travel overseas to get it within a limited within a limited time span. So it's much easier to get live donor transplants for people on island, and trying to identify people who are fit and healthy enough to be kidney donors can be quite a constraint. Also, it's really increasing awareness that that is a valid option for people to donate kidneys as live donors. But also the other thing is that any delay in diagnosis of end-stage kidney disease makes it harder to plan for transplantation. So although you can plan whilst people are on dialysis, it is much better to do it ahead of time so that they are prepped to have the transplant. And if you can do it before they actually need dialysis, that's much, much better.
Okay.
Yeah.
And given that care for chronic kidney disease is so costly, does the report identify opportunities to curb those high costs?
So the best way to do it is to prevent people developing end-stage kidney disease in the first place. Now, so that's where kind of early identification comes in, lifestyle modification to prevent the conditions that predispose to get people getting kidney disease. And although we're talking about kidney disease today, a lot of what we're talking about crosses over a number of different conditions, so high blood pressure, diabetes, obesity, they're all kind of interrelated. So a lot of the kind of lifestyle programs that we're talking about will also influence the risk of getting diabetes and high blood pressure. So the main thing that to offset the costs is to get people earlier, get the appropriate treatment in place, then that will kind of prevent at least a proportion of those people ever needing dialysis.
Understood.
And the positive thing now is we have far more treatment options available that we know will influence the course of disease than we had even just 4 or 5 years ago. So there are things that can be done now.
And lastly, just for the Minister, are you able to provide an update on the STEPS survey?
I'm so glad that you asked that question because I'm going to use this as a moment for an advertisement. Actually, starting any day now, the parliamentary registrar, they are the ones that will actually select the 2,500 households. And from that point, each household that is selected, then they will ask one person to volunteer who's over the age of 18. That process is starting any day now. So if you get a call, for those of you that may not remember, the STEPS survey is critically important for us to be able to make informed decisions based on evidence, based on the health profiles of our population. So if you do get called to participate in the survey, it's a 3-part survey. It includes a questionnaire in terms of lifestyle, healthy living habits, et cetera, et cetera. It includes a mini physical, as well as they will come and measure your waist circumference and so forth, and then a blood sugar fasting test. So it is a mini medical exam, so you can take the results to your doctor and keep them and use them as at your pleasure. But more importantly, in order for us to make informed decisions on what we're doing and initiatives that we're advancing for the overall objective of a well Bermuda, we need the evidence, and the evidence can be collected from the STEP survey. So if you're called to participate, we invite you to please do so.
Thank you. Thank you. Laura Gazette, would you like to ask some questions? No? Okay, thank you. Well, that concludes our press conference. Thank you, everyone.
Okay,
Thank you.
thank you.